Let's talk about gout. Gout can be an extremely painful condition, and a lot of people take it lightly. Oh, it's just my gout. But actually, it can really affect you even systemically. So I definitely think it's worth talking about. Hi, I'm Dr. Neha Banasali. I'm a rheumatologist. I love talking about autoimmune conditions, arthritis, and lifestyle medicine. Let's talk about gout. Gout is a type of arthritis, also known sometimes as gouty arthritis, and it can affect anyone. It's often sudden, severe attacks of pain. You can have redness and swelling. It could be very tender. It could be in only one joint, or it could be in a lot of different joints. Often it affects the big toe, but it can be in so many different places. Sometimes even the weight of your bed sheet can be very painful for that tender joint. The symptoms can come and go, but they can be very painful when they happen. If you've ever had gout, you've probably heard from other people, maybe websites, Dr. Google, that there are some foods you should cut out, and you should. I think it'll be very helpful if you cut out high purine foods. But the problem is, if you have a high amount of something we call uric acid in your blood, then it's not going to make a huge difference to cut out all the bad foods that cause gout. What I mean by that is, let's imagine that your level of uric acid in the bloodstream is about 10. Let's say you're going to cut out all the purine-rich foods, alcohol, red meat, certain types of seafood, and you're hoping for a change. Well, if your uric acid level is 10, that's a big change that you need to do. And most of the time with lifestyle, with different fruits and vegetables and avoiding purine-rich foods, you'll make about a 1 point to 1.5 point difference in terms of your uric acid level. So absolutely, especially if you're a borderline, it's your first episode of gout, or maybe your second, and you have really borderline levels, then it might be worth it to just do lifestyle and see if that will be enough for you. But if you have a very high level of uric acid, something like 10, 11, then you're probably going to need medication as well as lifestyle changes. Now, sometimes you don't need as many lifestyle changes because the medicine is helping you so much, but oftentimes this is an indicator that maybe you should improve your lifestyle anyways. What is uric acid? It's actually a waste product in your body. It's from the purines that are broken down, and then you're left with uric acid. Why do you have high uric acid in your blood? Well, sometimes it could be medications, such as diuretics. People take those for several different reasons. It could be drinking too much alcohol, or maybe soda, or other foods that have high fructose corn syrup. It could also be high blood pressure that's associated with it. It could be immune suppressing medications, or even genetic, that everybody in your family has gout, your mother or your father or your grandfather, then genetically that you're more predisposed to having it. So there's so many factors for having this uric acid buildup in your body. If you're diagnosed with gout, this is a good time to look at your own health. And if it's not something that's extremely genetic that every generation has, it might be you. So yes, absolutely start eating better. Cut out foods that you know you're not supposed to have. If you've gained a lot of weight, this might be the time to start reducing that weight to see if it can help your body. But there's also other things that you could do. For example, taking medication such as allopurinol. Now, I want to say a little side note about that. Allopurinol is usually the standard medication that we give for somebody that's had more than a couple episodes of gout and that we're assuming is likely going to have more. It's a great medication. It's been around a long time, and we know a lot of the potential side effects that it can cause. But more recently, there has been recommendations from the American College of Rheumatology that there is a certain population of people that should be checked genetically with a blood test to see if they may have some sort of allergy or may have more of a likelihood of getting an allergy to allopurinol if they're in the certain subset group. And that is people who have a background such as the Han Chinese, Korean, Thai, or Black Americans. Any of those groups are considered more likely to have this hypersensitivity to allopurinol, so definitely should be genetically tested. And then there's other populations as well that might benefit from that. But definitely worth doing before starting a medication like allopurinol, because if you do get that hypersensitivity reaction, it's awful. I've seen it in my patients, I've seen it in friends, and sometimes it happens. It's an awful reaction when it does happen. But otherwise, if there is none of that, then it's a great medication to use. And we have other medications if you cannot use allopurinol. So if your levels of uric acid are very high, it's unlikely that just lifestyle medicine is going to bring it down. And you may need to do a combination of things. But if you're choosing to try natural treatments, I think there's a lot of great things that you can do, such as, and if you're going to look online, you can see a list of purine-rich foods, so you could try minimizing those, but also increasing something like low-fat dairy. If you happen to drink a lot of milk and eat a lot of ice cream, that's really not low-fat dairy. So you want to make sure it's low-fat because that's actually been associated with better outcomes. And if you do eat seafood, then it may be better to eat certain types versus others. For example, you want to limit the amount of shellfish, anchovies, sardines when you eat because they have more purines. But on the other hand, you could have more of a tilapia or flounder or cod, more of a white flaky fish, as they're less associated with gout flares. So you could do dairy, you could do some seafood if you want to get omega-3 that way. But there's also other foods that have been associated with a better outcome, such as tart cherries. Now, the research is not wonderful on it, but probably doesn't hurt to have all those great antioxidants anyways. And the newest research is showing probiotics may actually be beneficial for people who have gout. They had a small study, it was a Spanish study that was just 30 people that they tried it on. They gave half the group the probiotic and the other half had allopurinol. Over 6 months. It wasn't super short, but when they analyzed it, they said that people who had gout and got the Lactobacillus salivarius, which was the probiotic, had a significant reduction in the number of gout episodes and in the use of gout-related medications, like you might be taking anti-inflammatories or something else for gout attacks, but they had definitely less of a use for that. Additionally, those who used the probiotic also experienced improvement in some other blood parameters like oxidative stress, liver damage, and metabolic syndrome. Are we ready for this prime time, not using medications and just using probiotics? I don't think we're ready for it. I think we definitely need more studies though, and it's very exciting, and I'm hoping that it'll be something that we can use in the future. But right now, if you have a very high level of uric acid, definitely lifestyle changes are in order because there may be something else that you should probably improve upon as well, but medication might be needed. However, things to try. So decrease your purine-rich foods, but also increase maybe low-fat dairy. You can increase eating certain fruits like cherries, but also vitamin C is very associated with benefits in this. Eating more strawberries and peppers and adding those in your diet. So we want to reduce the amount of gout attacks and improve pain overall. Another diet, so people are always looking for different types of diet that could maybe help. Something called a DASH diet was also associated with improvement in gout symptoms. DASH diet stands for Dietary Approaches to Stop Hypertension, and it's basically using less salt, and there's some other parameters to it, and that actually helped reduce the amount of gout attacks. The uric acid in those people when they were on this diet was 0.25 milligrams per deciliter. So the higher the starting uric acid level was, the greater the decline. So if you wanted to try a diet, that's the one that's associated. So there's so many different measures you could use lifestyle-wise that could help. Gout is something that most rheumatologists do like to treat because while it's not curable, it's definitely treatable. There are people who have had long-term gout and they've damaged from it. So you want to be careful with gout. Don't call it just my gout. Is it damaging your joints somewhere else? Are you getting little holes in your bones from gouty damage? Because that can happen and that's not reversible once you get it. It can impact how you walk, how you feel, how your mood is when you have active gout. So get it treated or look for different ways to treat it if that's what you prefer. But if you enjoyed this video on gout, press the subscribe button so you can see these videos right away when they come out. And let's keep talking about healthy lifestyle, wellness, and how you can live your best life with lifestyle medicine.